Good day, everyone. I'm John Christenson. I'm a professor of clinical pediatrics at Indiana University School of Medicine and at Riley Hospital for Children in Indianapolis, Indiana. Thank you very much for the invitation to be able to speak to you. The topic is vaccines. It's impossible to talk about all the vaccines and all the different concepts surrounding vaccination. However, we'll touch on some key points that are important for clinicians throughout the world. I have nothing to disclose. I have no financial relationships with any of the pharmaceutical companies that produce vaccines. When you look at the morbidity and mortality that has been associated with vaccine preventable diseases, there's no question that the vaccines have had a major role in eliminating a lot of these, not only in the United States, but throughout the world. Best example of that is smallpox. When you look at the incidence of polio, it's been eradicated in most countries of the world, including in the Middle East. And there's been a significant reduction in morbidity and mortality associated with other vaccine-associated diseases such as measles, rubella, and even Haemophilus and Streptococcus pneumonia. When you look at the effect of vaccination in the United States against invasive pneumococcal infections, vaccinations, the conjugate vaccine, had a major role in reducing invasive disease in the United States, especially those causing meningitis as well as bacteremia. Now, when you look at diseases that associated with great mortality in many countries around the world, the best example, a recent example of vaccines being very successful has been rotavirus vaccine, a vaccine that is readily available in many countries around the world, including Jordan and in the Middle East. As you can see here from this graph, a reduction in mortality was observed after its introduction in use in Mexico many years ago. So undoubtedly, the vaccines are beneficial and reduce the disease burden that we see associated with these vaccine preventable diseases. But what you find is that every country devises their own immunization schedule according to the different pathogens that they want to prevent from affecting their population. This is the schedule this year for the United States. As you can see, it's a very busy schedule compared to the schedule of many other countries. And there is vaccines, protecting against hepatitis B, rotavirus, diphtheria, Haemophilus, pneumococcus, as well as polio, varicella, as well as measles, and others. And you can see there that the schedule, this is what clinicians here follow in the United States. There's even a schedule for those children that have not met the regular schedule. There is a catch-up schedule as well, and these are published every year by the American Academy of Pediatrics, American Academy of Family Physicians, and the Centers for Disease Control in our federal government. There's also a recommended schedule for vaccines in individuals that are at high risk of certain types of infections, specifically pneumococcus for sickle cell, for those with cancer, etc. Now, many other countries, or most countries, will have immunization schedules of their own, right? This is something I downloaded from the internet. But you can see that Jordan has its own immunization schedule that clinicians in Jordan follow. And you can see that it covers, special pathogens such as polio, also diphtheria, hepatitis B, Haemophilus influenza, measles, and it starts off with BCG to prevent disseminated tuberculosis. But very important, you can see there that it also includes rotavirus vaccinations to prevent gastrointestinal infections as well. So every country has a version of their immunization program, and these are the programs and schedules that clinicians will follow in the country where this schedule is being used. Now, a lot of questions arise by parents as well as clinicians of why are our schedules built the way they are. And as you can see that, at least in the United States and very similar in Jordan and other countries, a lot of vaccines are given in the young ages because you want to vaccinate these children and protect them before the peak of the diseases, specifically Haemophilus, the same thing with polio and rotavirus. You want to vaccinate them because in the younger ages is when the greatest morbidity and chances of coming down with an infection may occur. And obviously you want to prevent the mortality associated with these. Some of the vaccines are given at an older age because we want to avoid the interference from maternal antibodies that come from that may affect varicella, vaccines such as measles, mumps, rubella, and what you find is that that this is what we expect that clinicians will follow, and not alternative schedules that may delay protection. Now, the reality is that these vaccines are geared to protect against diseases. This is measles. The reality is that in the United States, and I'm sure that in other countries as well, there is great concern about safety, right? Parents want the best for their children. They don't want to harm their children. So there is no question that there is some hesitancy. So it's very important for us to educate people. Some of these concerns of fear are real, or some of them may be misinformed. But the delay in vaccination results in infections and outbreaks. We know that. Now, what one obstacle for vaccination in many countries is the fact that if the vaccines are not covered by governmental agencies and they are free, people may not get vaccinated. So it's very important that vaccine programs be covered by national governmental programs. We have to educate parents about the importance of vaccination, but at the same time, we have to educate healthcare workers about the need for vaccines and why it's so important that these vaccines be given. And more important, every country and all health authorities have to have a good understanding about the epidemiology of the different conditions in the country, but also need to understand why people are under-vaccinated. And you can see there, I'm quoting an article that was published in the Journal of Pediatric Nursing this past year, specifically dealing with some of the issues surrounding under-vaccination in Jordan. So the important thing is that in spite of all our efforts, there's great hesitancy, and clearly a movement against vaccination is seen in every country around the world. And no question that this threatens the health of people. And we've seen this specifically with COVID vaccine, at least here in the United States. The important thing for all of us is that we have to continue our education of parents. And these are educational posters from the Pan American Health Organization that specifically does that. It targets education of parents surrounding the reason why vaccination is so important. Also, we have to educate clinicians, right? Now, we do our best to minimize the number of injections that we give to children, because this is brought up frequently by parents that, that my child is getting too many vaccines at the same time, too many jabs, right? Too many injections. So industry continues to develop vaccines that are combination vaccines. This is a new one, a hexavalent one that protects against diphtheria, tetanus, pertussis, polio, Haemophilus, as well as hepatitis B, and it's available in many countries, including the United States. Now, every country has to deal with specific pathogens, and specifically, you look in the United States, influenza is an important pathogen for us. It's seasonal, and we tend to see infections that cause severe disease and morbidity. This is a patient of ours at our intensive care unit that, thanks to the expert care of our intensivists here at Riley, they were able to save this young man who had an infection with influenza B complicated by Staphylococcus aureus. This is not an uncommon complication, and sadly it leads to deaths in many children in the United States every year. So we would like to prevent influenza, which is what starts everything. Similar diseases are also seen with Streptococcus pneumonia, and you can see there the effect that Streptococcus pneumonia vaccinations had on disease activity in young children specifically. So the vaccines are very effective, like I initially showed you. But the reality is that when you look at an organism like Streptococcus pneumoniae, where there's so many different serotypes, you have to maintain active surveillance of the epidemiology of the different strains that circulate in a particular community. And the reason behind that is, as you can see here, as the initial conjugate vaccine, what was referred here in the United States as Prevnar 7, which covered 7 serotypes. What we saw with time is that we saw the emergence of serotypes that were not covered by that vaccine, and that led to the development of a conjugate 13 valent, which is the Prevnar 13. And it specifically to include this serotype 19A. The reality is that there is a continued emergence of new strains and new serotypes. So there is this continued shifting of serotypes, and we're seeing that locally with breakthrough meningitis episodes with Streptococcus pneumonia. And you can see here that now the pharmaceutical companies are coming out with newer vaccines that cover more serogroups or serotypes. And there is now a Prevnar 20 and also a 15 valent vaccine. Right now they're targeted towards adults who are at increased risk of pneumococcal infections, but soon they'll make it into the pediatric arena. And you can see here that highlighted in red, you'll see all the different new serotypes that are covered by the various vaccines. So you can see there that you have to continue surveillance and epidemiology so you can change the vaccines as needed. And this is very important that every country has this type of system in place. Meningococcus is occasionally we'll see cases here in the United States in our hospital. But for example, in parts of the world, this is sub-Saharan Africa, as all of you recognize, the so-called meningitis belt. There's been throughout the years, many epidemics of meningococcus in this area, specifically with group A. And because of that, the vaccine was devised to specifically target, this particular group. And it was instituted and was highly effective in reducing group A meningococcus in this region. The sad thing is that, like similar to Streptococcus pneumonia, now there is a shifting of groups, and now additional groups are being described as causing disease in these areas. And because of that, you have to adjust your vaccine using the epidemiology that you have. And now there are some studies being done where they include group X, in a conjugate vaccine, and has been used in Mali and has been shown to be quite effective. So once again, the vaccine technology has to change according to the epidemiology of the pathogens in the region where you're at, okay? Also, you have to contend to, this is is now being recognized as a problem here in the United States, is antimicrobial resistance among Neisseria meningitidis is now well recognized here in the United States as well. So the prevent for this, a vaccination program would have to be instituted, especially in countries where meningococcus is a serious problem. In parts of Asia, they've been hit hard by these extensively drug-resistant Salmonella typhi. Typhoid fever is a problem in parts of South Asia, especially India, Pakistan. And the only way they control these infections that are caused by strains that are resistant to a lot of different antimicrobial agents is to use vaccination. The sad part of these is that these organisms will not stay localized in Asia. They have moved now to many parts of the world, including the United States. Some of that related to travel, but also we now have strains that are circulating in the United States with no history of travel. So I am certain that probably you experience a similar problem in your country as well, because this is not limited to the United States or even Europe. Okay. Now the reality is, the vaccinations is emerging. It's not a static science. Here's a good example of that is that in many countries around the world, there is limitations in access to rabies immune globulin as well as rabies vaccine. So you'll have, the World Health Organization has made specific recommendations depending on the type of exposure that people will have to animals that may transmit rabies. And you can see there that on categories 1 and 2, there's no use of rabies immunoglobulin. This is a change significantly as well to deal with not only the epidemiology of the disease and transmission, but at the same time to deal with limitations in vaccination and immunoglobulin products, which varies from country to country. Now, we also know that we cannot have a talk about vaccines without talking about COVID. And you can see, many of you have seen this Swiss cheese respiratory virus pandemic defense that was devised for COVID. You can see all the institutions of physical distancing and masking, and including here vaccines being very important for the protection against COVID. The reality is that vaccines for COVID has been consistently shown to reduce hospitalization, to reduce deaths, and including even in adults as well as in adolescents. And so this is an emphasis that is very important in many countries. I know that many countries have struggled in getting sufficient vaccine to vaccinate enough people. Here in the United States, the patients that are moderately or severely immunocompromised are at increased risks, just like they are in other countries. And there's recommendations surrounding boosters. I know this is a big challenge for some countries because some countries have limited access to vaccines and have not been able to even complete the first 2 or 3 doses. But the reality is that to control the pandemic, additional vaccinations are going to be needed to maintain it in an endemic manner rather than the pandemic that we're suffering right now. The reality is that even in a country like ours here in the United States, even when we have access to vaccines and we could provide vaccines to anybody at any age, obviously we're talking about children over 5, you can see there that there's a large number of children that are still unvaccinated in the young age groups. So we have a great challenge that we need to get to these people and get them vaccinated. Okay. The also reality is that a lot of focus on vaccination is now targeted towards preventing disease in young infants. And this can be done by vaccinating mothers as well against not only influenza in this case, but also against pertussis as well as COVID. So vaccinations of the mothers protects the infants, especially in the first several months of life. The important thing is that we need to remind people that we need to get people vaccinated. This is a friend of mine who's a physician in Guatemala in Central America, getting his jab there against COVID, and he's encouraging people to get vaccinated. Vaccines are great, but if we don't get them into the arms and legs of children and adults, they're of no utility. So thank you very much for your time. I appreciate the invitation to speak to you, and I hope that you will all do well. I included my email in the first slide, so if you have any questions or if you have any comments, don't hesitate in contacting me. I appreciate the time you've spent with me. Best of luck to you, and I hope you enjoy your meeting. Thank you very much.